Hi, Dr. Evelyn Rizzo. You've just been told you have asthma. That word can feel heavy, and when doctors start throwing around medical jargon, it's easy to feel lost and a little scared. But what if understanding your asthma is the key to getting back in the driver's seat? Well, you're in the right place. We're going to cut through the noise and give you the clear, simple facts you need to understand your condition. Team up with your doctor and take back control of your life. All right, let's start with the basics. What is asthma really? At its heart, asthma is a long-term condition affecting the airways in your lungs, the tubes that carry air in and out, called your bronchial tubes. For someone with asthma, these airways are always a bit sensitive and inflamed. You can think of them as being permanently twitchy. This just means they overreact to things that wouldn't bother other people at all. This isn't a cold you can get over in a week. It's an underlying condition that's always there. Even when you're feeling great, that low-level inflammation is still hanging around, setting the stage for what's known as an asthma attack or flare-up. So, what's actually happening inside your lungs? It really comes down to three main things. Get these three and you'll get asthma. First, inflammation and swelling. The inside of your airways gets red and puffy, kind of like your skin after a mosquito bite. When your body senses a trigger, it sends in immune cells that cause this swelling, which squeezes the airway and leaves less room for air to pass through. Second, you get extra mucus. Your body normally makes a little mucus to trap dust, but with asthma, this system goes into overdrive. You end up with a thick, sticky mucus that can clog up those already narrow tubes, making it even harder to breathe. And third, there's something called bronchoconstriction. It's a big word for a simple idea. Your airways are lined with tiny muscles. During a flare-up, these muscles can suddenly tighten up and squeeze the airway shut. This is that twitchy reaction we talked about, and it can shrink your airways in a flash. Imagine a garden hose. Inflammation is like the inside walls of the hose getting thicker. The extra mucus is like thick sludge getting stuck inside. And bronchoconstriction is like someone suddenly kinking the hose shut. When all three happen at once, getting air through is a real struggle. That combination is what causes all the classic asthma symptoms. Now that we know the science, let's connect it to what you actually feel during an attack. It can be hard to describe, but understanding why you feel what you feel can make it a lot less scary. The classic symptoms are shortness of breath, chest tightness, coughing, and wheezing. Let's break them down. Shortness of breath is that awful feeling that you just can't get a deep breath, like you're trying to breathe through a coffee stirrer. That's the direct result of your airways being narrowed by all three things we just covered: the swelling, the mucus, and the muscle squeeze. There just isn't enough space for the air to get through. Chest tightness feels like a band is squeezing your chest, or like someone's sitting on it. That sensation comes from those tiny muscles around your airways, squeezing tight. It's also from the sheer effort of your chest muscles working overtime to pull air into your lungs. Coughing is another big one, and it's often worse at night or early in the morning. This isn't a normal cough. It's your body's natural reflex desperately trying to clear out that thick, sticky mucus and react to the irritation from the inflammation. And finally, wheezing. That's the high-pitched whistling sound you hear when you breathe, especially when you breathe out. Think about letting air out of a balloon by stretching the neck. The narrow opening makes the air whistle. It's the exact same idea in your lungs. Air being forced through those tight, swollen, gunk-filled airways creates that sound. Now, in a very serious attack, the airways can get so tight that not enough air can move to make any sound. This is called a silent chest, and it's a medical emergency. It's also good to know that asthma has different levels of severity. Some people have mild asthma where symptoms are rare. Others have persistent asthma where symptoms are a daily challenge. Figuring out where you are on that spectrum is step one in creating a battle plan with your doctor. One of the most powerful things you can do is become an asthma detective and figure out your personal triggers. A trigger is anything that irritates your twitchy airways and kicks off that chain reaction. Everyone's triggers are a bit different, but there are some usual suspects. First up, allergens. For a lot of people, asthma and allergies are best friends. This includes pollen from trees and grass, which is why your asthma might act up in certain seasons. Indoors, you've got dust mite-steeny critters in bedding and carpet-spet dander from cats and dogs, and mold spores in damp places like bathrooms. Next are irritants in the air. These don't cause an allergic reaction, they just flat out annoy your airways. Tobacco smoke is a huge one, including secondhand smoke. Air pollution, strong smells from things like perfume, cleaning supplies, and fresh paint can also be enough to cause a flare-up. Respiratory infections are a super common trigger, especially for kids. A simple cold, the flu, or a sinus infection can inflame your airways and make your asthma flare up for a while. This is why getting a flu shot and washing your hands are so important. For many, exercise can be a trigger. This is called exercise-induced bronchoconstriction. When you work out, you breathe faster and often through your mouth. pulling in colder, drier air that can irritate your lungs. But this absolutely does not mean you should avoid exercise. With the right plan, pretty much everyone with asthma can and should be active. Even the weather can play a part. Cold, dry air is a classic trigger, but so are sudden temperature shifts, high humidity, and even thunderstorms, which can stir up pollen and mold. And believe it or not, strong emotions can be a trigger. Stress, anxiety, or even a big belly laugh can change your breathing patterns and sometimes lead to an attack. Lastly, some medications can cause problems, like beta blockers or even common painkillers like aspirin or ibuprofen. It's so important to tell every doctor you see that you have asthma. Figuring out your triggers is all about observation. Try keeping a simple diary of your symptoms and what was going on right before they started. Once you know your enemies, you can start to avoid them. Getting the right diagnosis is the first real step to getting in control. The process is a bit like solving a puzzle, and your doctor will use a few different pieces to see the full picture. It almost always starts with a good chat. Your doctor will want to know all about your symptoms, what they feel like when they happen, and if they wake you up at night. They'll also ask about your family history, since asthma and allergies tend to run in families. Then comes a physical exam. The doctor will listen to your lungs with a stethoscope to check for that telltale wheezing and look for other signs of allergies, like eczema. But the main event is usually a set of lung function tests. These are painless tests that measure exactly how well your lungs are working. The key test is called spirometry. You'll take a huge breath in and then blow out as hard and fast as you can into a machine. It measures how much air you can blow out and how fast. With asthma, the amount you can force out in the first second is often lower because your airways are narrowed. Then, you'll likely take a puff from a rescue inhaler and do it again. If your numbers get a lot better, it's a huge clue that you have asthma. You might also use a simple handheld tool called a peak flow meter. It measures how hard you can blow out and is a great way to monitor your asthma at home day to day. A newer test you might hear about is the FeNO test, which measures nitric oxide in your breath. Higher levels can be a sign of the specific kind of inflammation common in allergic asthma. You just breathe steadily into a machine for about 10 seconds. Simple. Your doctor might also suggest allergy testing to pinpoint exactly which allergens are causing you trouble, which is incredibly helpful for your trigger avoidance plan. Getting a diagnosis can feel like a lot of steps, but every single one gets you closer to a clear answer and, more importantly, the right treatment plan to get you feeling better. Okay, you have the diagnosis. Now what? This is where you start to take back control. The goal of asthma treatment isn't just to stop attacks, it's to control the condition so well that you can live a normal, active life with hardly any symptoms. Your toolkit will have two main things: medications and a personalized action plan. Asthma meds fall into two very important categories, and you have to know the difference. Relievers and controllers. Reliever medications or rescue inhalers are for quick relief. You use these when you're actively wheezing, coughing, or short of breath. The most common is albuterol. It works in minutes by relaxing the tight muscles around your airways to open them up. Think of these as your emergency tool. They rescue you from symptoms, but they don't fix the underlying inflammation. If you're needing your rescue inhaler all the time, that's a major red flag that your asthma isn't under control. That brings us to the most important category: controller medications. You take these every single day, even when you feel great, to manage your asthma for the long haul. The workhorse here is an inhaled corticosteroid. These are not the same as the steroids bodybuilders use. They are a safe, anti-inflammatory medicine that you inhale in a tiny dose straight to your lungs. They calm down the swelling and reduce mucus, making your airways less twitchy and less likely to react to triggers. By using your controller every day, you're treating the root cause of the problem. A critical part of your toolkit is your inhaler technique. If you don't use it right, the medicine just ends up in your mouth instead of your lungs. Your doctor or pharmacist can show you how. Many people use a spacer, a small tube that attaches to the inhaler. It holds the medicine so you can breathe it in more slowly and effectively. The final, most vital piece of the puzzle is your asthma action plan. This is a written plan you create with your doctor that is your personal roadmap for managing your asthma. It's often color-coded like a traffic light. The green zone is for when you're feeling good. It tells you which controller meds to take every day to stay in the green zone. The yellow zone is your caution light. It tells you the warning signs that your asthma is getting worse and exactly what to do, like temporarily increasing your medication to get back to green. The red zone is for a medical emergency. It spells out the signs of a severe attack and what steps to take, including when to call 911. Everyone with asthma needs a written action plan. It empowers you to spot trouble early and stop a major attack before it starts. Managing asthma is more than just medicine. It's about building smart habits into your life. With the right game plan, asthma becomes something you manage, not something that manages you. First, get good at outsmarting your triggers. If you're allergic to dust mites, use allergen-proof covers on your pillows and mattress. Vacuum and dust regularly, maybe with a mask on. If pets are a trigger, making the bedroom a pet-free zone is a great idea. If pollen is your nemesis, check daily pollen counts online and keep the windows shut on bad days. A healthy lifestyle is a huge help. A balanced diet full of fruits and veggies can support your overall health. And maintaining a healthy weight is important because extra weight can make breathing harder. And let's talk about exercise again. So many people are afraid of it, but regular exercise actually strengthens your lungs. The key is to do it safely. Talk to your doctor. The plan will likely involve using your rescue inhaler about 15 minutes before you start. Warm up properly, cool down, and choose activities you love. Swimming is often great because the air is warm and moist. With the right plan, you should be able to play almost any sport you want. Monitoring yourself is also key. Your doctor might have you use a peak flow meter every morning. By tracking your numbers, you can often see a dip that signals trouble before you even feel symptoms, giving you a head start to act. Don't forget to manage stress. For some, stress and anxiety are major triggers. Things like deep breathing exercises, meditation, or yoga can calm your mind and in turn help your breathing. Finally, build a great partnership with your doctor. See them for regular checkups, even when you're well. Asthma can change over time, and your plan might need tweaking. You are the most important person on your healthcare team. There's a lot of bad information out there about asthma that can cause needless fear. Let's bust some of the biggest myths. Myth number 1. Asthma is a childhood disease you outgrow. False. While it's very common in kids, you can develop asthma at any age. And while some kids' symptoms might improve in their teens, the underlying condition is still there and can come roaring back later in life. Myth number 2. If you have asthma, you can't exercise. Absolutely not true, and we can't say this enough. Avoiding exercise makes you less fit, which can actually make you feel more out of breath. With good management, people with asthma can be and are top-tier athletes. Myth number 3. Asthma meds are addictive and dangerous. This is a harmful myth. Asthma medications, especially the daily controller inhalers, are not addictive. They are essential for preventing dangerous attacks. The risks of uncontrolled asthma are far, far greater than the risks of the medication. Myth number 4. You only need your inhaler when you're having an attack. This is a huge misunderstanding. This is true for your Blue Rescue inhaler, but your controller inhaler must be taken every day, even when you feel perfect. To prevent attacks from ever starting, skipping it is like canceling your fire insurance because your house isn't on fire right now. Myth number 5. Asthma isn't that serious. This is the most dangerous myth of all. Yes, most people control their asthma well, but a severe attack can be life-threatening. Taking the condition seriously is what motivates you to manage it properly, which is what allows you to live a normal, healthy life without fear. Section 8. The future of asthma treatment. The world of asthma treatment is always advancing, and the future is really bright, especially for people with more severe asthma. The big idea is moving away from a one-size-fits-all approach and toward personalized medicine. The biggest game changers recently are biologic therapies. These aren't pills or inhalers. They're specialized medications usually given as an injection every few weeks. They are designed to target the very specific cells or pathways in your immune system that are causing your type of asthma. For people who don't get relief from standard inhalers, these can be life. Technology is also stepping up. We're now seeing smart inhalers with sensors that track when you use them and can even tell if your technique is good. They sync with an app on your phone, giving you and your doctor amazing data to see what's working. Research is also moving toward creating more tailored treatments that will be even more effective at keeping symptoms away and letting people live life to the fullest. We've covered a ton today, from what asthma is to how you can master it. If you take one thing away, let it be this. While asthma is a chronic condition, it is absolutely manageable. A diagnosis is not a life sentence. It is not a barrier that stops you from running, playing, and living a full and vibrant life. By understanding what's going on in your body, learning your triggers, teaming up with your doctor, and using your tools correctly, you have everything you need to take control of your health. Knowledge replaces fear with confidence. You've got this. If you found this video helpful, please subscribe for more clear, simple health information. And remember, this is for educational purposes only. Always talk to your own doctor to create a plan that's right for you.